Hi, my name is David. I'm in Bon Secours Memorial College of Nursing, class NUR3205, which is Advanced Nursing Practice. Today I'm going to demonstrate the skill of setting up a PCA pump. A PCA pump, also known as a patient-controlled analgesic pump. The purpose of the PCA pump is for a patient to be able to administer their own medication and have some control over their own care. Now, the times that they would use the PCA pump is for post-operative pain control, as well as for palliative care purposes, if a patient end-of-life care or chronic pain that they may have, as well as like if there's patients that have had a cesarean section and they would use it for post-op pain control. So what we have today is we have in my facility we use the Hospira Life Care PCA pump. And the types of medications that we use as far as for the PCA pumps, the most common ones are for the morphine, Dilaudid, and fentanyl. The thing to keep in mind is each one of them has their own different strengths and potency, so you need to verify that it's the proper medication for the patient, as well as you need to keep in mind if patients may be allergic to certain medications too. So if there's any contraindications for them to use it, you need to address that with the physician. Now, not everybody is a candidate for a PCA pump. Some of the considerations you need to keep in mind is, one, if the patient is coherent enough and able to manage administering their own medication, because it is the patients are the only ones that are supposed to administer their own medication, not the family or the staff members to use it out of convenience. The other thing to keep in mind is if they are physically able to administer the medication. Some patients may not have the dexterity to be able to press the plunger to give themselves the medication. If that is the case, you need to talk to the doctor to see other ways to manage their pain control. Okay, so I'm going to go and walk through the different types of the settings that they have, as well as a step-by-step on how to set it up. Now, these PCA pumps, they have the most common settings is you have the PCA basal rate only, so it's just a continuous dose of medication the patient gets. You also have the PCA pump, which is whenever the patient pushes it, they get a dose of medication at whatever interval the order's for. And you also have the PCA with basal rate, so it's whatever the patient gives themselves, as well as a continuous amount that they would be receiving too. Okay, so before you start, you need to verify you have the right order for the medication, the proper medication for the proper patient, and that's usually something you would check with us in your electronic medical records and the orders from the physician. So once you have your medication, and what I have today is a simulated Dilaudid vial. You would get that from the pharmacy. You have your pump. You have your the PCA extension set with the injector assembly in it. You would also have the key to open up the PCA. You also would need to make sure you have some primary tubing for the infusion, that way that the medication is getting to the patient instead of the small doses being left in the line. And you want to make sure that the primary infusion set actually is dripping into the patient and not occluded, so that the patient can get the medication. So I'm going to, since I do not have a patient with me, I'm going to simulate, and we're just going to use this gauze to show how to prime the line and how to administer it. Now, the first thing I'm going to do is I would go ahead and make sure to foam in or wash my hands, put on any proper PPE that would be needed. I would then go in, introduce myself. I would verify that it's the right patient by the patient identifier. Okay. I would also go in and educate the patient on what we're doing and how to how to operate the pump themselves. So, okay. First of all, I'm going to prime I'm going to first self-prime the tubing. So you have your injector assembly. Take this off. Using aseptic techniques, you're going to set up the injector assembly with the injector assembly, and it's going to screw into the tubing. You're then going to take the other end of the injector assembly. Keep in mind it does have an exposed needle, so you need to be mindful that you do not accidentally stick yourself. You're going to take that, you're going to screw it into the vial so it's stopped. Now if you look, there is a bubble of air in here. You need to make sure to prime all the air out of the vial as well as the tubing itself. To do that, using a hard surface, you're going to put the vial upside down. You're going to take the loosen up the cap for the tubing. You're going to slowly push down until all the air is out of the vial and out of the tubing. See it dripping right there. Okay. And then you're going to then do this. As you see with our system, we have a barcode here, and it also says what the medication is. You are going to then open up the door to the PCA pump. Now the chamber that the vial goes into is right here, so you pinch it, raise it up all the way. If you look inside here, there's a barcode. That needs to line up with the barcode on the vial. The way to put it in, you want to put the bottom in first so you don't accidentally chip the top glass or crack it. It will automatically turn on. You squeeze this, push down until it locks in place. The pump is going through a self-test to make sure everything is okay with it. You're going to hit continue. Is this a new patient? Yes. It's going to clear all the memory out of there. Okay. Okay, so now you have it lined up. You verify in the machine that this is the proper medication, which shows the Dilaudid. It's the 1 milligram per ml, and you need to then hit confirm. Now we are using the standard dose, so we'll go ahead and click that. Purge. We have already purged it manually, so we do not need to purge the line. Hit no. Set loading dose. Sometimes the doctors may order a bolus loading dose prior to the administration of the PCA pump. In this situation, we're going to say no. We're not giving a loading dose. Now here's where you have the different options: the PCA only, PCA plus continuous or basal rate, or the continuous alone. We're going to, for purposes of this demonstration, we're going to do the PCA only. So you click PCA only. Now, looking at the order that the physician wrote, you're going to program the machine. So we're going to say the order was for 0.1 milligrams every 6 minutes. Enter. And for a maximum dose of 1.5 milligrams per hour. 1.5. Enter. Now you're going to then requires a 2 nurse to verify that you have the proper program settings in the machine, and they will, after they verify and confirm it, they will then do the 2 nurse sign off on the bar. So we've confirmed that. It is then going to say to close and lock the door to begin. So you close it,
lock it.
It has been, the pump has been programmed properly. We're going to then connect this to our primary line before connecting it to the patient. Now, this Y port here is where you would connect the PCA line to your other IV, continuous IV infusion. And I have that already here. I already have the line primed. What you're doing is, like I said before, using aseptic techniques, you're going to remove this cap. You're going to remove the cap to the other line, connect it together. And then, as you see right here, one of the common things that you may see that nurses forget to do is in this section of the tubing, when we primed the PCA pump tubing and got all the air out, that puts medication in here. If you do not flush this out with your other IV fluids, then you can, prior to connecting it to the patient, you can give the patient a bolus dose of medication. Some of the things that could happen with that is they may have more medication than, and it could cause them to get sedated too. So you need to, once it's connected to your primary line, make sure to flush the medication out. To do that, you're just going to open up your primary line, let it drip through. As you see, I'm flushing out the dilaudid. It's a minimal amount, so you don't really have to worry about the recording of it. Okay, so you flush that out. Once that is flushed out, then you would connect this to the patient's IV site. So we're just going to simulate this is connected to the patient, and you're going to then have your primary line going at either whatever the rate is, if it's like 50 mLs an hour, or at least a minimum KVO, so keep the vein open at 10 mLs an hour. You're then going to educate the patient how to use the PCA pump. Very important step. This right here is the pendant. This is what you give this to the patient, educate them on how to use this, letting them know that letting them know that they are the only ones that are supposed to push this, not the patients or not the staff for convenient purposes. Let them know that they can push this whenever they're feeling pain, and it's going to give them a small amount at the interval that it's set for, so they cannot overdose themselves as well. So you tell them to go ahead and push it. You get the little beep, and as you see right here, it's administering that 0.1 milligram of dilaudid towards the patient. As you know, 0.1 milligrams is a very minimal amount. That's why you need to make sure to have your primary tubing or IV flowing. Some things to keep to educate the patient or monitor the patients is that they are not getting going into becoming overdosed. And some of the things to look out for there is if they have respiratory depressions, their oxygen levels might drop. So a best practice would be to make sure that the patients have oxygen nasal cannula and as ordered by a physician, and that there aren't any contraindications for that. Another thing is that with the PCA pumps, every shift you verify with the oncoming shift. You do the 2-nurse sign off and go over the history to make sure to see if that is managing the patient's pain, or and that the medication has not ran out either. Okay. Like I mentioned before, some of the things to look out for is that the patient the medication is appropriate for the patient. There aren't any contraindications. They do not have any allergies towards the medication. They are not over-sedated. Then they are able to actually comprehend and work the PCA pump. This concludes my video on how to set up a PCA pump. Thank you for watching.